Zoom-a-loom. I am here with my very good friend, Mayim Bialik, and I was actually Bialik, and I've actually told her I was gonna mess it up. I never use her last name in front of her for the last 5 years of knowing her, and I just had to ask her how to say it. I even watched TV last night to okay, anyway. So Mayim is here with us. We are very excited to have you on. For all those following with Movement RX, we've got people from HR departments, benefits departments, we've got employees, employers, we've got workout people, we've got adaptive athletes, we've got Mayim's audience. This is very exciting. So, and we have a very much needed topic today that we're going to be discussing. And I am Dr. Theresa Larson. I will be the host of this, kind of like Conan O'Brien, but not. And maybe more funny. I might be more funny. And in the background looming is Dr. Skelly here. So he'll stay quiet. He gets hungry every once in a while, but he'll stay quiet. So Mayim, can you just tell us a little bit about yourself? And of course, I mean, you can look on the internet, everyone. However, this topic that we're discussing today, she has a specialty in it. And I'd love to learn we want to know a little bit more about you and why you got into this.
Sure. Well, first of all, thank you for having me. Yes, we have been friends. I actually was a fan of yours from reading your book, Warrior, and we've formed a really beautiful friendship and feel very close to you and the work that you do. So I'm really grateful to be in any way a part of what you do. In terms of me, yes, I'm an actor. Most people know me as an actor. I was on a show called Blossom when I was a teenager. I then went to grad school, or I got my undergrad degree in neuroscience and Hebrew and Jewish studies. And then I went straight to a PhD program. So I took a 12-year break from acting, and I had my first son in grad school. He's now 14. And my second son I had right after receiving my doctorate. So he's now 11, almost 12. And I had trouble breastfeeding both of my children. And after my second son was born, I became a certified lactation educator counselor. That is different than an IBCLC. I just want to say that. An IBCLC, an International Board Certified Lactation Consultant, is someone who has 500 hospital hours. I do not have hospital hours, but a lactation educator counselor is someone who is trained in the principles of lactation, and we are taught anatomy and physiology and also some of the psychology of breastfeeding and the challenges women have. And what I do is, for the last 10 years or so, I do private consulting. I do work for free. I work by referral, mostly from women in my community. I do house visits for free. I do everything that I do to the best of my ability because of the women who did it for me. And usually if you struggle with the first, the second one is typically easier. That was not the case for me. I had just about every problem that you can imagine. And so I became a lactation educator counselor to help other women. And while I am a lactivist, as we call ourselves, I'm someone who believes strongly in the rights of women to breastfeed. I'm also an advocate for women making choices that work for them and their families. So I'm a very flexible lactation educator counselor, and many of us are. So I'm glad to talk about workplace things. I was a working breastfeeding mom. I do consult for a lot of working breastfeeding moms. I've also consulted for women who also supplemented. I've consulted through the weaning process. I tend to also do consults on sleep and also baby wearing, two things that are very intimately connected to breastfeeding. So I kind of do, I help at all stages of breastfeeding, and I typically do consults during pregnancy because that's when it's important to try and start learning about breastfeeding so you know what to expect.
Well, so this is exciting, being that I'm about to have my second son. So I'll show everyone my belly here once again. I could go into labor any second, but I also have a number of friends right now who just had newborns and are having trouble breastfeeding. And so I never thought anything of it until obviously I had a child. And my first one, I didn't really have many issues. I hope to not with this one, but I know who I can have on speed dial if I do. But I know many women do. And so it's very exciting to be able to talk about this topic. But first, I also want to mention that with Mayim, one of the things I really admire about you, and I want our whole audience to know this, is that you are a force of a woman in the world. Like, you're completely unstoppable. And the fact that you have a voice, like, you're a lactivist, but you're an activist too. You talk about socially responsible topics, like things that can be controversial to people that they don't want to bring up: mental health, racism, injustices of women, sexism. Like, you're not afraid to talk about those things, being a boy mom, being a single mom. I really admired the way you've presented yourself in the world. I mean, you're not only an actress, but and juggled that schedule, which you've taught me a little bit about. That schedule can be crazy. But then also, like, going to get your degree because you just want to learn more. And then now and then your own problems with breastfeeding, like, you wanted to learn more about how to help others with the same situation. And I really admire that, because it's very easy to do something, arrive, land an acting job or land a big job and then say, I've arrived, I'm done. But you're constantly learning and constantly working to help people. And so that's one of the things that has really drawn me to keep in touch. And also it's almost like you're a sister from another mister. We just actually are different sizes, and we have actually some of the family stuff and life stuff. We live these almost like parallel lives. I've been telling my husband this, but it looks just vastly different. Yeah. And I really have loved connecting with you. So for those listening, like, Mayim is not just, this amazing woman here talking to me. She's also a very good friend and someone I respect a ton. So yeah, let's kick this thing off. So I think so now that we know a little bit more about what a lactation counselor does and why you got into it, can you dispel some myths about breastfeeding and lactation?
Yeah, I mean, I'm sure if we took a survey, we'd hear a lot of the same kind of myths. And one myth in general that I come up against a lot is a lot of people expect that if they speak to a lactation counselor or a lactation consultant, that they're going to be really told that the only answer is to breastfeed, and you have to keep breastfeeding, and there's nothing else you can do. You just have to breastfeed. And if you don't breastfeed, you're a bad mom. And the fact is that's actually that's not the policy of lactation workers. What we are designed to do is to assess a situation and empower women to make decisions that work for them. I do believe very strongly in breastfeeding, and there are a lot of reasons. But ultimately, the health of the family, the health of the mother is incredibly important. And there's never a simple solution, meaning you should never be told, just keep breastfeeding, and not be given appropriate education, resources, and support. One of the reasons that breastfeeding can be hard is that we don't live in communities the way our ancestors did. And by ancestors, I mean a long, long time ago, not just 50 years, not just 100 years, not even 1,000 years, but for all of human history, women lived and played with their children, with other women around. So breastfeeding was constantly seen. Yes, people wore very little clothing in prehistoric times, but the notion of breastfeeding really became cloistered more like in the last 200 years or so. And yes, that did coincide with the male entry into obstetrics. Midwifery was the way of most birth for most of history. And along with midwifery came instruction on breastfeeding and caring for a baby. And when that got kind of Victorianized and moved into hospitals, and women were told to lay horizontally, and they were starting to be medicated, you had a real shift in how we viewed breastfeeding and the care of children. So that's also another kind of general myth to dispel. Breastfeeding should be easy, but for many, it is not. And most problems can be solved very simply. And the ways that I solve most problems is by providing information. Many women don't even know how their body is making milk in order to know how to keep it making milk. And the other thing is to know about very, very basics about positioning. That almost always solves pain, discomfort, and all of the complications that come from incorrect positioning. So the last myth I'll talk about, and then we can go on to the next question. I mean, we could go on all day. The last myth is that, there are just some women who don't make enough milk. And this is one of the most commonly reported problems that I hear about why people couldn't breastfeed, is that I didn't make enough milk. And while there is a very, 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 very small percentage of women with certain genetic metabolic issues that have to do with literally the production of milk, in almost every case that I have heard and that I have been taught about, if women don't know how their body makes milk and they don't know how to establish and maintain a milk supply, what it will look like is that you don't have enough milk. And that may be true in that moment, but there absolutely are remedies for that. And many women simply do not have the mental or physical strength to pursue that, which I also completely understand. But the notion that some women just don't make enough milk is actually almost always because there were other issues that maybe didn't get addressed. And you can be an absolute great mom. You can have an attached child, even if you don't breastfeed. That's also true. But for those of us who do believe in breastfeeding, there are ways to solve many, many problems. And many of those problems can be solved very simply and inexpensively also.
So that's really interesting because I've heard all of those, of course. And thankfully, I had a guzzler of a child. And for most of his first year, I was able to feed him, but I kind of ran out of milk. That's the way I perceived it, of course. Or I just maybe thought he wasn't interested anymore. It was probably around 11 months. And I remember you mentioning, because we were going to India for a month, and this was probably when he was like 1.5. And I was like, oh my God, what am I going to do with a toddler on the plane? And you're like, well, why don't you start breastfeeding again? I was like, you can do that? You can start. And so I actually, that last myth is interesting, especially for working moms, because that is probably a common thing that you think about, like, well, I just don't have the time anymore. I don't know what to eat. I don't know how I can do this at work. And they often run out of steam to be able to produce milk and want to produce milk. So
makes sense.
So I think we should dive into ways that women can have longevity with their milk supply and realize they can keep producing milk, and maybe some ways to do that.
Yeah, I mean, I think that, and also I should note that, the needs of an 11-month-old are very different from the needs of a newborn.
Of course.
And the fact is, relactating is separate, but you were still in a window where, if that was still something that was available.
And I had no idea.
Correct. And also, anyone who's successfully breastfed on a plane knows that it is literally the best way to make a child happy and make everyone else on the plane happy. So it's one of my favorite tools for airplanes. But one of the main obstacles when we go back to work, and I've counseled women who've gone back to work at 4 weeks, and I've counseled women that have gone back to work at 4 months and 4 years, the full gamut. But one of the main challenges is the notion that our body will do exactly what we want when we want. And if pregnancy and labor and recovery did not teach you that, breastfeeding will. We don't have the mastery over our bodies that our culture would have us believe that we can have. And by that, I mean, we live in a very fast-paced society. Everything's instant, especially as empowered working women. We want what we want when we want it. And breastfeeding is a very humbling experience. And that is one of the ways that it humbles you, which is the reason a lot of women don't want to breastfeed. I've also spoken to people who say, I don't want to be at the mercy of my body. I want to eat what I want. I want to drink what I want. I want to smoke what I want. And you're completely allowed to think that and to have that experience. But for those of us who breastfeed, yes, if you do go back to work, there is some planning that you do get to do. And the fact is, if you do not continue the demand for milk, your supply will show that. And It is a fairly simple equation. If you've been nursing a child, say 8 times a day, and you go back to work and you only pump once a day, and you come home and you nurse twice, your body knows that that's a very significant difference. And so what your body will do is start to compensate, and it will start sending out less milk. So then let's say you have a vacation week and you're like, all right, I get to breastfeed now. Your body's going to only know 3 feedings with time.
Right.
It's not going to know that you want 8 anymore. And you will have a frustrated child because the milk's not coming out like they want. Can you build up a milk supply? Absolutely. Is it labor intensive? A little bit. You need to reintroduce to your body that demand. So when women go back to work, it's really about managing your expectations. And pumping is something that a lot of lactation consultants will not talk about. I am breaking a little bit with ranks, and I've decided to break with ranks, and I speak very publicly about that, that there are lactation consultants and counselors who will say, I don't do pumping, I do breastfeeding. And my feeling is that I'm happy to engage with women who want to keep breastfeeding, even if it looks like using bottles and pumping. Many women do realize very quickly it is much easier just to breastfeed than pump and do bottles. And there are a lot of reasons we don't want to introduce bottles too early, which those are real considerations. That being said, if and when you do return to work, you do need to set out a plan for maintaining the demand. Meaning artificial demand, the pump's demand on your body. The baby is the most efficient extractor of milk. So a lot of women also will start to freak out when they see that not the same amount is coming out of a pump. The reason is the pump is not as efficient as a baby. And the second reason is that the stimulation of silicone or plastic and the motor is not the same as a human child. And again, in our society, we want everything to be like we want it. You know, I want food delivered from the restaurant to taste exactly as if I slaved over it all day in the kitchen. It's not going to taste the same. If you want to slave over it in the kitchen, you got to slave over it in the kitchen and do it on a day that you're not working, right? That's the thing. Your body's not going to, it's not going to think that it's the same thing. Some women have an easier time. I was one of those women who my body did not discriminate between silicone and baby. But every woman is different. Your stress level will absolutely impact your ability to let down milk. Absolutely. Going back to work is stressful. Being away from your baby is stressful. Those are things that your body will feel. That will add to it. Pumping in a bathroom, I've done it. I've also breastfed in a bathroom. It's not very comfortable. It introduces a stress to your body. Even if you think you're fine, you're not going to let down the same way. So it's learning also ways to condition your body to seeing pumping as equivalent as possible to feeding. Also, I do encourage breastfeeding as much as possible when you are home. And I do favor breastfeeding on demand. Even when you're home and even if you work during the day, it can be a wonderful bonding experience. Babies know when you're gone. I'm sorry that that's true, but it just is. And the first 3 months, babies don't really know they're separate from your body. So their consciousness really starts shifting at around 4 and 5 months. They often will want to eat a lot more when you're not there. So you'll also feel like I don't have enough milk. That's why we start pumping usually before going back to work so that we have a little bit of a buffer. But babies tend to want to suck a lot more when mom is not there. It's just true. So yeah.
That's fascinating. I mean, so that those first 3 months after being born is like the 4th trimester. I remember reading that. And then, so when is a good time to introduce a bottle if needed? So especially for those working moms.
Yes. Well, and I think that's what I was going to say. You know, I've had women call me and say, I want to go away with my girlfriends. Can I leave my 2-week-old at home and pump bottles? To which the answer is, I can't decide for you what is necessary. Sure, traditionalists, even of the non-breastfeeding variety, would say like 2 weeks is still very new. You may want to stay a little closer to home or find a way to have baby with you. Or, I mean, again, these are personal decisions and everybody gets them. I don't believe that a baby needs to learn a bottle, like constitutionally, meaning for some women, it is a very high priority to be able to leave their child as soon as possible. For those women, there are resources for how to do that. Typically, we like to leave the first 6 weeks to 3 months with only the nipple being in a baby's mouth, meaning the only stimulation of that baby's lips should be on your body. That's why we tend to discourage against pacifiers as well, because it can and does interfere with the demand, because babies do want to suck frequently. And in the first 3 months, it takes 3 months to establish and maintain that milk supply. So for those first 3 months, your body needs to know how much that baby wants to suck. And yes, sometimes they suck for comfort. Your body knows the difference between a comfort suck and a meal suck. The baby does do different things. So the idea is to have that stimulation for the first 3 months, establish that milk supply. After that, people tend to get friskier. That's when, you can say like, oh, I'll introduce a pacifier. And yeah, it's exhausting having you be a baby's pacifier. 100% it's exhausting. That's also an expectation that I think every pregnant woman who wants to think about breastfeeding needs to know. It is absolutely exhausting to feel like you are a human milk machine. It's also the way the human body was designed. And yes, it is one of the limitations of being a modern woman, is that breastfeeding reminds you that you have breasts and they are there to keep a baby alive. And yeah, that can feel very constricting for some women. And I totally get that. And I felt frustrated. I felt mad. I felt angry. I felt like I was only good for my milk, and like I didn't even get any love or smiles for the first couple months. Also,
totally overtouched.
Right. And for me, that was having a support group, having other women. I went to La Leche League meetings, which was very, very helpful, just to hear other people going through it. And that honestly, for me, is what was able to keep me going. So I know I didn't give you like a time of when you should introduce a bottle, because like I said, my business is breastfeeding more than bottles, but it is not true that if you don't introduce a bottle in the first 6 weeks or the first 2 months that the baby will never learn to drink from a bottle. It's simply not true. Just like a baby eventually weans, they will learn to drink from a bottle. It is frustrating, but guess what? Being a parent is about you helping your child manage things that they want and things that they need. And just like you wouldn't say it's easier to give the 4th lollipop than to take it away, it's sometimes, you sometimes do have to put in some labor to train yourself and your baby. You're learning together.
So that is fascinating. Like, I think for the working woman, just for those that go back after 6 weeks or 4 weeks, or, the nice thing is that there are options. I didn't really know much about breastfeeding with my first kid. I just knew that he was good at it, and I was an entrepreneur, so I could work from home and feed him a lot. But I was also very excited to introduce the bottle to just have a break.
Sure.
There are mental health components to, so if someone is struggling with postpartum depression, I know we discussed this before, like I'd like to go into that a little bit, because one, there's the work demand for some women. But then there's also the fact that just mentally they've struggled before during the pregnancy and they're struggling now. And how do you work with women like that who are struggling with the mental health piece?
No, it's a great question. It's an important question. And it's exactly the kind of question that needs to be included in conversations about women's health in particular, and all of our health. I think more and more, especially with what's going on in the world, in the country, everyone's mental health is being impacted to different degrees for sure. But in terms of how this relates to breastfeeding, even a woman who's never struggled psychologically or psychiatrically, being pregnant is a huge challenge to your mental health. Labor and all of the complications and fears and anxiety, even with a smooth birth, the recovery from birth is hugely taxing. Hormonally, it's taxing. Your hormones are your mood, ladies. If you haven't figured it out yet, newsflash, your hormones are your mood.
Men know that.
Exactly. Men do know that, sometimes in an appropriate way.
They need to be reminded.
But the notion of baby blues is something that is on the normal spectrum of many women's experience. And that is that the expectation and the excitement is very quickly shattered by the fact that your whole body hurts. If you've had a C-section, you're recovering from major abdominal surgery. Nothing feels like it should. Nothing looks like it should. Everybody wants to help, but they just irritate you. I mean, I'm describing my experience. I couldn't even follow the news or a normal conversation. I had a very rough labor, my first one. My child was in the NICU. My brain was going to explode. I do have a history of anxiety, depression. I have OCD. My postpartum experience was very complicated, as it is for a lot of women who have past history with mental health challenges. That being said, there is a distinction between baby blues and postpartum depression, and those are well elucidated on many legitimate and good websites. Postpartum depression is a very, very persistent and very dangerous and acute condition that often comes with some psychotic thoughts, meaning thoughts that are not kind of lined up with the linear universe. Fears are normal, like the fear of dropping the baby, very normal. Compulsive or repetitive fears and obsessing that you might possibly hurt the baby is something that is not abnormal, but it's something that needs more immediate attention. There are many medications that are deemed safe for breastfeeding and treating postpartum depression. This is also a wonderful time to realize that you need support. La Leche League International is a great example of a free support organization. They are not breastfeeding activists who won't let you do anything else. These are groups of women, peer-to-peer support. These are women who have successfully breastfed children who gather other women together. They meet virtually. They also meet in parks. And I always went to different parks is where my meetings were. You have to have support to get through these kind of challenge, just period. If you have money for a therapist, fantastic. I use that as well. But for people who don't have that, there are support groups. And I don't mean mommy groups where you go and compare whose baby is best or whose baby is happiest. I'm talking about groups that are designed to
I don't go to those groups.
Right. Well, and a lot of women do, and they expect to get love and support, and instead it feels competitive and scary. And that's why groups like La Leche League, and that's LLI.org, La Leche League International.org, that has meetings in your area, in most cities and most areas where you can get support from women who are struggling like you are and who aren't just posting on Instagram about how great things are going. So postpartum depression is very serious. The sooner you get help, the sooner you can ask questions, the better. And it should be distinguished, like I said, from baby blues. It should also be distinguished from chronic depression that occurs outside of this period. And often medication can be a bridge to feeling better. And there are many other non-medication ways to also handle depression, but when we're in an acute phase, we do want to. One more thing I'll say is that I've consulted with women more than once or twice where there's a high level of despair and hopelessness. And when I ask more questions, I often find that we don't have a supportive partner, or we have a partner who's saying, it's hard, why do you keep doing this? Like, just use formula. And while that sometimes is a medically necessary intervention, it's very important to figure out what parts of the relationship can be supportive, and how women can get help in the relationship if that's also part of the challenge. So there's a lot of other factors, but breastfeeding has to work for the family. It should not be there to create strife between husband and wife. You know, a lot of people think that people who bed share safely or co-sleep safely, which is a thing to do. A lot of people feel that that divides husbands from wives. A lot of people feel that bottle feeding is so husbands can feel, or sorry, male partners can feel part of it. There are many ways for your partner, whether it's a man or a woman, to feel involved and engaged in breastfeeding. But these are all issues that can factor into postpartum depression as well, and they're important to address.
That's really, so I was just thinking of, I'm glad you brought that up about the spouse, right? It's just like anything else in life, like the ability to have support, if you're a career mom, right? Like, then having your spouse be supportive of that is very important, just like the spouse, you being supportive of them.
Right. And even if you're just at home in those early weeks, you know, I remember my, he's my ex-husband, but at the time, he was like, you're going to breastfeed. I know you're going to do it and we're going to get through it. So let's do it. And like, I would be like crying and it hurts. And it's not that he wasn't sympathetic, but he was like, I'm the lion at the gate and we're going to do this. And that was helpful, but mostly I did need the support of other women as well. Cause they got it in a different, I wanted someone to be like, look at my breast. It's so sad, you know?
Yeah. Well, I'm thankful for my husband, who you met a little bit ago, like just preparing for this time with this new little one. And then the time after, I'm giving myself some time before I actually have to think a linear thought this time. Like the first time I like jumped right into work again, and I was like, my brain was just like mush. All I could think about was baby. So all of this is coming. Yeah. But yes, I would say in all aspects, that relationship with the spouse. I was going to say now, you know, for working moms, the employer, their boss. And I know we've got only a little bit more time left. We're going to have some questions here in a sec, but I want to wrap up this with just how can working women talk to their bosses about what they need? Because if you do want to breastfeed, and I mean, can you bring some offices may allow bringing their babies to work, but a lot of them may not. And so keeping up with the supply and maybe a way to think about approaching the boss, because as we've seen with a lot of the comments, people have so many different experiences and some are really not good.
Right. Well, and I think like this is also, you know, it's hard taking individual stories and making any sweeping statements.
Sure.
I think what's important to know is that there are laws about breastfeeding now, and you can look up what's appropriate for your region or for your state. Also, La Leche League International is helpful in helping you know what your rights are. But I'm going to be super honest. Like even in my job, when I was on Big Bang Theory, it feels awkward to say, I need a minute, I'm pumping. Like it doesn't feel comfortable. And look, I know fearless women who are just like, I'm pumping, you'll need to wait. That's not my personality. And for a lot of us, especially women who were raised in the culture that we're raised in, we're often told like, don't make trouble. Like, just like, can you just do your thing in the corner, you know? And it's important also to know that not every battle needs to be fought every single time the same way. Meaning there have been times when it has been more labor intensive, more time intensive, more energy intensive for me to like go to the powers that be. Sometimes it's just like, I'm just going to sit down right here and I'm just going to pump real quick. And like, nobody needs to know, and I'm just going to do it. So that doesn't mean that I'm not a lactivist, that I have pumped in bathrooms, that I have nursed my kid in bathrooms rather than fighting with people in front of my children. I mean, like that's all the thing. There's a lot of different features to when we fight which battle. But knowing your rights, and I don't mean speak gently like a woman should. I mean, we as humans get a lot farther with honey than with other things. So the more we can use I statements, the more we can talk about, here's what I know is provided by the state of, fill in your state. The more we can speak like that instead of, you need to give me this space, I'm owed that. That's, you know, you don't want to be confrontational. And I think also, have your personality. You know, I'm not saying don't be who you are, but I think we have to understand that we're in the process of trying to educate a lot of men and women about breastfeeding, its significance. I mean, I've had doctors in the NICU say like, breastfeeding doesn't really make a difference. Just like make sure he's drinking a bottle before you leave the NICU. So there's going to be a variety of opinions, and that's also okay. And the fact is, ultimately, you have to kind of bloom where you're planted. And you have to decide, you know, what are the things you can shift on and give up. And also there have been a lot of improvements in pumps. When I first used a pump, it was not as sophisticated and efficient as they are now. I used a manual pump, actually, the kind where you go like this, with my second, and it was actually the best solution for me. I could pump anywhere while feeding a toddler and dealing with, I mean, like I really, for me, a manual pump was great. They do have the corset kind where it goes in, and there's actually a really cool spread in, I think it was Vogue, of an actress whose name I can't remember, wearing one of those with like a full face of makeup. So there are ways to do it efficiently and just make it work. And also I think the most important thing to remember is you shouldn't be ashamed of breastfeeding your child, meaning if you'd feed a bottle, you can feed your baby. And we didn't really get into modesty issues. You know, my feeling is anywhere that you can see a bottle, you might see my breast. And I'm sorry, like it's the function that they serve. I know you prefer your breasts to look like they do on all the billboards, magazines, TV shows, and pornography that people like to see. But this is actually what my breasts do also. I like to say that every waiter within a 10-mile radius of my house has probably seen my nipples in the years that I was breastfeeding. And it's not that I didn't try to cover up, but my main interest is in feeding my child. And this is really how it works. I don't need to do it and be sexy about it. Some women like to show that sexy women can breastfeed. That's totally fine also, but it really is just feeding your child. So once we kind of bring the stigma down, we have to realize we've got generations of men and women who don't understand that. And so to be gentle and patient in how we teach them.
Thank you, Mayim. That's awesome. Like I like, you know, even just having a voice and being able to express yourself, feeding your child anywhere. I mean, that's part of being a human and it isn't something to be ashamed of. And I love, you know, also the fact that you're not afraid to talk about mental health, which is another stigma of you're weak if you have mental health issues or you're, you know, mentally incompetent, which isn't true at all.
Right.
So yeah, I really appreciate you bringing that up.
I want to say one more thing. You know, a lot of women are told not to breastfeed because they have a mental health history. That's also not always true. I was told, you know, by psychiatrists, like, ooh, you shouldn't breastfeed. It's going to mess with, and the fact is there are ways to figure it out and you can. The other thing is your breasts are going to change whether you breastfeed or not. I get asked this a lot. Your breasts are going to change. They change with age. They change if you've never had a child. If you gain any amount of weight and then lose it, believe me, the fat goes from your breasts. So your breasts likely change. Every woman has a different body. Some women will always have amazing perky breasts, no matter how many kids they nurse for how long. And some women won't. So that shouldn't be a deterrent. And also there's so many standards in our society that tell women what their breasts should and shouldn't look like. You know, what I like to say is I fed children with my body for over 6 years consecutively. And I look really good in clothes because that's just, I look better in clothes than not. So that's just what it is.
Nice. Well, with my first child, I fought with the wrap, like trying to cover up all the time. And so having this conversation and there's like a lot of pictures of me like hiding in the wrap with him, like getting really hot. And I'm like, okay, actually having this conversation is really helping me realize, no, I am just gonna be open about it and I'm gonna feel comfortable too. That my comfort matters too. And I'm proud of my body. So no wrap.
I've been glared at dozens of times. And I usually just would greet people with a smile, like, hi.
Yes.
Do it.
Kill them with kindness.
That's right.
Yes. Well, thank you so much, Mayim. I would like to open it up. We're going to have the voice from above. Dr. Megan is going to field, she's going to look up any questions we have and give people let's do about 5 to 10 minutes. And then call it a day.
A lot of the questions have been answered throughout, which is super helpful. So, you know, a lot on, you know, tips for long-term breastfeeding, having a routine when going back to work. You mentioned, you know, having a plan. I think an interesting one kind of along those lines is any tips for going back to work and breastfeeding and pumping when working with all male coworkers and needing to keep up the supply.
Yes.
You know, the rules tend to be the same. You know, I think that also sometimes, you know, I think Theresa brings up a great point that like a lot of women are told to hide, you know, and while I don't believe you should have to, there is a certain amount of your comfort that is important. And again, we need to meet you where you're at too. So, you know, some women use a sliding clothing rack, like the kind of portable pop-up ones at workplaces, where they literally bring that kind of rack and throw a towel over it so that you're creating at least one wall of protection. And also, I think it's important to not feel that that's a shameful act. That's a privacy act. So there's a difference between privacy and secrecy. Breastfeeding shouldn't be secret. There's nothing secret about it, but it can be private. And I think that some men are really interested in learning about breastfeeding. Many men are not. The same goes for women who haven't had children. And a lot of women are really curious and want to know things. And a lot of women are really judgy, even ones who have breastfed. So choosing who you speak to about breastfeeding is incredibly important, not just in the workplace, but your well-meaning mother, mother-in-law, best friend, aunt, who says, well, I don't know, but you're not sleeping through the night. I was taught to say, we're sleeping through the night. He gets up 10 times, but we sleep through the night. You know, like you have to be careful who you speak to about what. And I think coming up, this is something Willette taught me, coming up with simple responses, like, this is working for us, thanks for asking. Or, I'll ask my
Mm-hmm.
pediatrician, or my pediatrician's cool with this, or I've got it covered, thank you. And really kind of like being able to pivot the conversation. I'm going to say also, men make really vulgar comments about breastfeeding. So do some women. And I'm not saying all men, but there are some men who are uncomfortable with breasts doing what they do.
Mm-hmm.
And that's totally fine. I don't need to educate every ignorant man on the planet who's going to make rude comments about my tits, you know? I've taught my children that we call them breasts. That's a really good first guide, so that when someone would say like, oh, how are your boobs? I would say my breasts are doing, you know, what they were intended to do. Thanks so much. But I think a lot of pivoting is probably going to be necessary. And also knowing, again, you don't need to fight every battle.
Yes.
Know who to talk to about what, and do your business in a way that's comfortable and efficient and makes you feel empowered.
I like that advice too. And that's just in life. I feel like you got your top 5 people that you can go to, right? Like same with mothering advice. And not having a mother on this earth, I'm like, there's just a handful of women I'm going to actually ask advice for. You're one of them. And that's pretty much it. Like Dr. Google, no.
Oh, yeah, I like to caution about looking things up on the internet, really about any of this. And the internet's an amazing thing, but I'd like to remind everyone, when I had my first child, we did not have internet at our fingertips. We didn't have smartphones. We read La Leche League's Mothering magazine. We read Mothering magazine. We read La Leche League's magazine. The Womanly Art of Breastfeeding. If you buy one book to have as your Bible of breastfeeding, it's called The Womanly Art of Breastfeeding, and it is fantastic. In terms of websites, don't Google random things about breastfeeding and expect to not be confused or frustrated or break down crying. Right. Kelly Mom, Kelly Mom, is a really, really good resource. And LLI.org, LaLecheLeagueInternational.org. I really discourage against things up and trying to find anecdotal answers.
Awesome. Those are great resources. And we'll put those in the show notes too when we write this blog. Anything else, Megan?
I think another great one, asking about how can we go about changing legislation when it comes to time off from work? Do you have any resources?
This is a really difficult question. This is its own hour. I will say I'm not the authority on this topic, but the holistic answer is that that is one piece of the puzzle. And as we've seen just in the last, month and years, as with race, there are ways to Band-Aid it and there are ways to fix it. And the ways to fix this issue is to go beyond just that legislation and see if we can work towards a government that supports parenting in general. And that means maternity leave, it means paternity leave. It also means resources for things that have the lowest infant and maternal mortality rates, which is, you're gonna hear me say it, midwifery and natural birth. And natural birth centers, those tend to have significantly better results for moms and for babies. And yes, Northern European countries have instituted these kinds of things, and it does work to have a government that values mothers being home initially, typically, and also fathers being home with paid paternity leave. It is a thing that happens in countries. So that is the kind of big picture stuff that we need to have to start having it trickle down to more specific legislation about simply valuing the relationship between a mother and a child, whether they're breastfeeding or not.
So this could be a whole nother discussion at some point. Yeah. Well, I think we have time for just one more question and then we'll.
Yeah, so we'll finish up with hopefully a little more straightforward one. So breastfeeding, if someone's breasts hurt or if they have a cold or flu, and then somebody also asked about coffee and wine.
Okay. I'll try and be quick about it. Breastfeeding should not hurt, but it sometimes does. The first 6 weeks can be hard if they're hard. If you have an inverted nipple, a pseudo inverted nipple, if you have what we call short shanked nipples, which means a nipple that doesn't stand out as much, if your baby has a recessed chin, if there's any tongue tie, if you have a large nipple proportional to the baby's mouth, those are all things that can cause pain. Most of those problems absolutely can be fixed with tummy to tummy, nose to nipple. So making sure the baby is absolutely facing you with their nose aimed directly at your nipple, meaning the head not up here, not down here, and bringing the baby to your breast and not the breast to the baby. Those are the most common positioning things that can go wrong and cause pain. Absolutely, if you have the cold, the flu, if you have H1N1, which some of us did, you absolutely nurse that baby. Your milk is natural vaccination. Your milk has antibiotic properties, antimicrobial properties. It can also be used on cuts and sores and mosquito bites and diaper rash. Milk is the best thing to do if you are sick. I literally had H1N1 and nursed my child who did not get it. Everyone else in the house had it, and the nursing baby did not get H1N1. I've also nursed with migraines with Aura, which is a terrible thing to do. In terms of caffeine and wine, I tend to believe that if you can train yourself to not have caffeine, it's one less thing for us to think about or worry about when we're trying to figure out why your baby might be having trouble breastfeeding or might be fussy. If caffeine can be minimized, that's even better. In terms of wine, this is a harder question. There are some people who absolutely do not believe in drinking. Typically, if you want to have a glass of wine, the best time to do it is while you are breastfeeding, because it takes 2 hours for milk to be metabolized. And in that time, the highest concentration will be in your blood, and it will have left your body at the highest concentration by the time baby nurses again in approximately 2 hours with a young baby. That being said, if you feel tipsy, your milk is tipsy. You just have to know that. This is a great time to give a pitch for Alcoholics Anonymous, for Al-Anon, for anyone who needs help, who's having trouble struggling with not drinking. And believe me, my friends and I used to joke, if not for red wine and dark chocolate, we might not have made it through the first year. But do know that if you are tipsy, your milk is tipsy. It is a toxin. It's a toxin for you. It's a toxin for your baby. If it makes your baby sleep, you should be worried about that. And I like to joke, if that would have made my baby sleep, I might have had more to drink. But typically think of it as a toxin. It's a toxin for you and them. Pumping and dumping is a thing that women do. I've had people call me and say, I smoked a lot of weed last night. What do I do? I take those calls too. So I've also had major surgery while breastfeeding, and you can also pump out the anesthetic milk. You can also dilute it down. So that you don't have to throw out all of your milk. But I've had abdominal surgery for several hernias while also breastfeeding, and you can still breastfeed.
Wow. Thank you, Mayim. That was super helpful. Like, I didn't even actually, during pregnancy, no caffeine. I don't even have I have a little desire for wine, but caffeine, it just repulses me. So, but I know that can be, eating, drinking can be a coping mechanism for mental health issues, but just something that people miss when they're pregnant. So those are helpful. All of this is packed full of very helpful information for women. So you gave us a lot of great resources. Thank you so much for being a guest. I learned a ton today too. And if I go into labor tomorrow, I feel way more confident with my strategies on how I'm going to feed my child. So thank you so much as always, and we'll find another topic that's helpful for women, maybe on sleep, that we can cover at some point too, because maybe in like 2 months when I'm actually not sleeping and
I'm available. I'm available for you personally. So I'm sure I'll hear from you before everyone else does. But thank you for this opportunity, and thank you. I'm sending you love and good wishes for good news soon.
The same. Thank you. All right, everyone.
Bye, Pear.
All right.